Well, it was a mistake that turned deadly for a patient at Vanderbilt University Medical Center. A nurse was supposed to give that patient a sedative to relax them before a body scan, but instead the patient ended up dead the next day. Let's go to News Channel 5's Jason Lamb, who is here to explain what happened and the impact on the hospital. Jason?
Yeah, that's right. The drug the Vanderbilt nurse is said to have given to this patient is one of the same drugs that the state uses to execute death row inmates during lethal injection. And for some time, the hospital had been on the hook for Medicare payments had they not solved the problem. According to a report from the Centers for Medicare and Medicaid Services, the mistake happened the day after Christmas last year when a patient who had been in the hospital for 2 days for brain bleeding was ordered to have a body scan. The patient said they were claustrophobic, so a doctor ordered a sedative, Versed. A nurse went to search for the drug using an automated dispensing machine and had typed the first two letters of Versed, which are VE, and chose the first medication on the list. But that first medication was vecuronium, a drug that can cause paralysis and, in fact, is used by the state on death row inmates during lethal injections. As the nurse unknowingly administered the drug, the report says she told the patient they were there to give them something to help them relax. Minutes later, they found the patient in cardiac arrest. That's when a fellow nurse noticed the error, telling the nurse, "This isn't Versed, it's vecuronium." The report says even though paralysis develops and they can no longer move or even breathe, patients are still awake and aware of what's going on. Patients can experience intense fear when they can no longer breathe. They can also sense pain. The experience can be horrific for patients. The patient died the next day. Now, because of that mistake, for the last month, the Department of Health and Human Services had threatened Vanderbilt University Medical Center that they would not be paying for any services that Medicare patients had done at the hospital. But we learned this afternoon that Vanderbilt University Medical Center had filed a corrective action plan and that those Medicare payments will still be made. Live in Nashville tonight, Jason Lamb, News Channel 5.
All right, Jason, what a story. Vanderbilt University Medical Center said today in this statement, here's part of it, that the drug mix-up occurred because the nurse bypassed multiple safety mechanisms that were in place to prevent such errors. The hospital says it took what it calls appropriate personnel actions following the mistake.